Dear students, right now I'm inside laboratory and it's an anatomy classroom, and here I'm standing with the head of this medical skill and practice. So in front of me here we have standing Dr. Constantine, and let's have some speech words regarding how the medical skills and practice does the students are participating, and how they are getting the skill knowledge about their medical training and practice. So let's have some discussion with. So dear sir, very greetings. Thank you very much for the participants.
Thank you as well.
We're from the Admission Medical, and we're going to be asked some similar questions, so that many things will be clear for the students, those students who are sitting far and they are watching us from there. And let's share some skill and experience to them. So
my pleasure.
yeah, so sir, can you tell how the students have practical training and the skills once they have admitted for medical programs, it's a 6 years programs in Georgia.
6 years programs, right?
For the
So,
medicines program.
and in those 6 years of this program, in those 6 years, we're gonna have 4 clinical skill courses, which of course will be just abandoned and distributed into the different semesters. First, for example, basics of the clinical skills will start at the 2nd semester, and it will contain the program regarding the help and care of some victims who just have, for example, cardiac arrest or other problems outside of hospital with some limited or no equipment at all. Regarding the 2nd course, which is already clinical skills and communication skills together, we will just teach students regarding the pre-hospital trauma support, so different traumas like bleeding, broken bones and other, as well as we will already start talking with the students regarding how to deal with the patients with the different emotional or other disturbances, like to just communicate with them well, so develop the contact between the patient and a victim or a patient and the student by himself. In the advanced clinical skills, which is going to start in 6th semester, we will already just go into the hospital, because the other clinical subjects are also starting there, and we will just teach students regarding how to deal with the different cardiovascular problems in a team, together with a team leader and other roles there as well too, together with, of course, surgery part. Those subjects, especially the 3rd clinical skill, which is the advanced one, will be integrated into the internal medicine and surgery together, so a student will not lose the contact between the practical and theoretical part there, which is I think really important to make the students' life easier to understand what they are learning and why do they learning this.
Great. Thank you, Dr. Constantine, and it's a really very informative speech you have shared with us. And,
thank you.
Thank you very much for these all things. Now I want to ask, how many capacity of beds hospitals are in your university management for the skill training for the students?
At this case, we have at this moment we have one big hospital with up to the 150, as I remember, beds there, and the capacity of the students who can go there in one day is up to 150 as well too. 150 students can go in one day, and I mean into this hospital. Of course, it contains different disciplines to, of course, just fulfill all requirements which students and the university has.
I hope there are multinational students have participated in this program.
Of course, sure. We have different students from the different countries, from the Qatar, from the Egypt, as well as the Japan too. So yeah, we're really transnational, I would say multinational, and Mostly we have foreign students.
Right, as well as from India also.
Yes, of course. And we're gonna wait for the Indian students as well too, and we would really be happy to have them and teach them medicine.
So Dr. Constant also shared others information to us, and sometimes I think the quality of teaching educations and what I have seen over here, and after met with Dr. Constant, it's lots of things has been clear for us, and hope you guys also got found really informatics information by this video, and hope you have all your queries or whatever queries you have remain to be know about it. Just you can ask us on this video, and you can we can just reply to you later. But for now also we're going to be add some other things also, like we have which classes now remain to be had take the
At this moment, we're gonna have a clinical and communication skill group, and clinical part. Communication skills are separated from it, and
sorry for interrupt. In this communication skill, I just interrupt you. Like, is like the communication of the language is English, or it's like
yes, English, of course, and there's mostly the target point is to just teach students to deal with the elder patients, with patients who talk too much or do not talk at all, to get the main information which they need to, of course, diagnose the patient as well as the help. And in this case, yeah, the main language is English because of this is an English program, and everything happens here in that language. So
thank you very much for your wonderful information. So thank you so much for watching.
thank you.